We are staying on top of breaking news. The first case of the Omicron variant has been found in North Carolina. In fact, right here in Charlotte. Here's what we know so far. Health officials say a student at UNC Charlotte was found to have the state's first confirmed case of Omicron. North Carolina now the 24th state in the country where the variant is confirmed. All of them you see there. They're highlighted on the map. Straight away, we want to get to WCNC Charlotte's Chloe Leshner, who's joining us live at UNC Charlotte. So, Chloe, we just heard from local health officials about this case. We're hearing the student was fully vaccinated. So what is the public health message tonight for folks given that information?
Hey, Vanessa. Well, there's still a lot to learn about how Omicron will behave, but honestly, those health experts that we heard from today said they were not surprised to learn that it is here in Mecklenburg County. Researchers here at UNC Charlotte are ramping up their abilities to genomically sequence those positive tests in the lab here in this building. That way we can have a better picture of just how many cases in our area are Omicron. As expected, Omicron has arrived. The first confirmed case in North Carolina was discovered on UNC Charlotte's campus in a fully vaccinated student who went out of the state over Thanksgiving.
Their symptoms appear to be fairly mild based upon the report to us, and we're in the isolation facilities that we have here on campus recovering from those symptoms, and so there was no hospitalization associated with this.
UNC Charlotte has a partnership with the county and StarMed to genomically sequence positive tests. They translate the virus's DNA into a language they can understand to determine which variants are spreading. Now that the first Omicron case has been found, more are probably coming.
I would assume that we are going to see more. I mean, I think that's just a given considering how we're seeing it spread in other countries.
Dr. Katie Passaretti, the vice president and enterprise chief epidemiologist for Atrium Health, says an increase in cases will also lead to some strain on the hospitals. She's hopeful that enough people are vaccinated or will now choose to be to soften some of the blow.
It is not a cause for panic. It's something that we are lucky that we have had some lead time to be able to prepare for, educate on, and make sure we're doing everything we can to protect the community.
So Delta is still the dominant strain, and some early research shows that Omicron may not be as severe as Delta, but it is looking like it will be more contagious. Everybody that we heard from today saying we need to get those vaccination rates up, and people who have already been vaccinated should go out and get their booster shots. Live at UNC Charlotte, Chloe Leshner, WCNC Charlotte.
Thank you, Chloe. And so given all that information, we do want to take a quick look back here on the timeline of some of the big happenings across this pandemic. It was March of 2020 when the first COVID-19 case was confirmed in Mecklenburg County. And then you could see fast forwarding July 2021. That's when we saw the first case of Delta. And of course, today marking the arrival of the Omicron variant. Certainly has been a journey, hasn't it? Keep in mind here, doctors say, and as Chloe mentioned too, that Delta variant, that's the one that is driving the current surge of cases that we are seeing across the U.S. and here in our state. By the numbers here, we're seeing this 3,600 new cases of COVID confirmed just in the past 24 hours in North Carolina. That 14-day average is moving upwards. It's right around 2,700, and compare that to about 1,700 about a month ago. Here's another graph illustrating that upward trend. We see the rate of tests coming back positive is now averaging about 7.4%. And you'll recall that last month we were actually close to 5%. That's the state goal, and also Mecklenburg County's threshold for removing the mask mandate.